Hi everyone, my name is Vincenzo Berghella. Once again, welcome to another session with AJOG MFM Live, the Extraordinaire within you, and Kavita Narang is here to lead us, and we also have an extraordinary guest today that she will introduce. Kavita, please, as usual, take it away.
Thank you so much, Vincenzo. And welcome back to all our old listeners as well as new listeners. This is our 17th episode already of The Extraordinaire Within You. I'm so excited and every month so grateful and humbled by all our guests and leaders that join us. For our new leaders, just a quick recap. I just wanted to restate the mission and vision of this podcast series is really to create a platform for global mentorship where we invite top leaders to share their stories to inspire us and help us achieve all these amazing goals and impact the communities around us wherever we are as well. Today I'm super excited and honored to welcome my extraordinary guest, Dr. Christina Han. Dr. Han is a professor of OBGYN and the interim chair and division director of MFM at UCLA. She's an active researcher and educator whose expertise spans both maternal and fetal complexities. She's a passionate clinician, educator, and leader who has contributed extensively in our field through her research, publications, and dedication to training the next generation of physicians. We're so excited to have you here with us, Dr. Han. Thank you so much for being here. I'd love for you to say a few words, and perhaps, we always start with anything you're grateful for, so feel free to join.
Yeah, happy to start with my gratitudes. As always, I'm just happy to be fed, clothed, housed, and be surrounded by love. It really is ultimately all we need in life. And for today, I'm particularly grateful to be here sharing this space with you guys. And as I was telling you before we started, I'm still wondering how I made it on this list. So.
You deserve it. That's why. Thank you so much for being here with us. We are honored to have you here. Vince, what about you? What are you grateful for today?
Well, first of all, I'm honored to have Chris here. She belongs big time. So welcome and great to see you. Also, family and first, but today I'll do a shameless promotion. We do the SMFM leadership course. Kavita is part of it. And just this week, we came out with this book, Lead Your Best Life Now, that really Idalin Curry, put together, with some help from Dan and Mike and I, but really, more than a year of work and really a lifetime for Idlin. And really congrats to her, gratitude from me to be part of that. And I hope it continues to help a lot of people. What about you, Kavita?
Yeah, first of all, just to piggyback on that, I want to say huge congratulations. I already ordered my copy. You guys can all get yours on Amazon. It's already available. I think it's less than a week delivery time right now. Super excited to read it. And I'm sure it's filled with so much amazing knowledge and wisdom in there. As for me, obviously grateful for family and everything. But last night I went to a women's in medicine event hosted by my university. And I'm just grateful for the inspiration from incredible women doing amazing things to continue to lead, to inspire, to change. It was a couple hour session, but I left feeling so inspired. And then, it's every month, like today, having the opportunity to sit with more inspiring women leaders, and men as well. But it's just a beautiful thing to see and to want to continue to follow in those footsteps. So I'm grateful for that. Yeah. Thank you. And, Dr. Han, we usually start our sessions with like one of my favorite questions always, if you can take us back many years ago or, wherever as far back as you'd like to tell us how your childhood or upbringing really shaped your life and your career.
Ooh, going way back now. So for the early childhood, I grew up in Taiwan. And for those who are not aware, Taiwan is, I think the best word for it is a ghost nation, in that it is very much a thriving community, economically, academically, culturally, such a robust nation, but unfortunately just not recognized by much of the world. And those cross-strait relations continue to be very tense. And that is primarily the reason that our family moved to the United States. So we did come over here via chain migration. And so all the recent topics about immigration is particularly near and dear to my heart. And when we decided to move, it was fairly last minute. And so I came to the US without not even knowing my ABCs. And in elementary school, essentially had to start over, relearn everything. And I very much recall in childhood sitting in the schoolyard by myself on the lawn, tying together daisy flowers just to keep myself busy because I didn't have anyone to talk to. Couldn't communicate with anyone. Even though I grew up in Northern California, where there are now lots of Asians, lots of Chinese speaking families, that wasn't the case when we first moved. And so I think that experience really has shaped how I deal with people in general. I'm always on the lookout for who's on the margins, who needs to be brought in the fold, who may be having difficulty feeling included, who may just need that extra support. And I think that is very much the crux of how I lead my group here, how I interact with the rest of our community.
Wow. How old were you when you came here, if you don't mind me asking?
I was 9 when I came over here.
Okay. And
so early enough to have lost my accent.
And then, so once you got here, kind of like, how did that journey evolve, into where you are today, like your journey to medicine, to education, and maybe, do you have siblings that you grew up with, or Yeah.
So I have 2 siblings. One is a very successful engineer, works for Apple. One who is younger, who's had a very tortuous life with some psychiatric diagnoses, some challenges, but now is through all of that and very much thriving. And we are a very close-knit family, multi-generational, like most Chinese Taiwanese families are. My grandfather, paternal grandfather, was a physician in Taiwan. And so in my childhood, I did spend time in the clinic with him, kind of watching the early sort of Western medicine introduction into Taiwan. And that kind of planted the seed for medicine. So I always knew as I was growing up that I wanted to explore something in the STEM field, something scientific. And regardless of what I explored, I always came back to medicine. And so I did my undergrad education through one of the 7-year combined bachelor's medical school programs, but actually ended up extending it to 8 years because I was having too much fun in the undergrad years and wanted an extra year of fun. But ultimately still, graduated under 8 years. And then in terms of my path then into maternal fetal medicine, when I started medical school, I said I would do anything but OBGYN. And here I am today. And I think the reason is that when you are a teenager and your first experience with a gynecologist is for chronic pelvic pain, for suspected endometriosis, with a fairly traumatic pelvic exam experience, all of that kind of mars what you picture an OBGYN to be. And so I was of the mindset of why would I want to do that in the future as a career? But when I did my medical school rotation, I rotated through Cedars-Sinai for my core rotation and fell in love with the field, had some phenomenal resident physicians who took me on, kind of saw my little spark of interest and really helped me grow from there.
Sorry, Vince, we can't hear you. Could you repeat that again?
Sorry.
Okay.
Chris, really inspiring. So in terms of, I'll speak as loudly as I can. In terms of, where you got your drive, one of the questions I like to ask all the time, you mentioned your maternal grandfather, for example, as a figure, but was there somebody else, a parent or anybody else who, to get in, for example, those shortened programs, and then you did 8 years, it's pretty competitive. So certainly you, like all of us, must have been an amazing student. What drove you then? What drives you now? In terms of you were looking up maybe to some certain people who had certain, internal drives?
Well, that's a great question. So, both my parents were graduates with bachelor's degrees. Nobody really beyond my grandfather had advanced degrees. And having moved in the K through 12 period with parents who didn't really understand the American system, they supported me as much as they could and are phenomenal, are really the reason that I am who I am today. But I did have to figure out a lot of it on my own. And I think that is also very much at the core of how I do everything now, is that I just kind of figure it out. If there's a problem, I will fix it. In fact, there's a sign behind me that says everything is figure outable. That is kind of my motto in everything in life. And so I think the drive, I wouldn't say that it's truly a drive of trying to constantly climb that ladder. It really is just being in the moment, being in whatever role I'm in, trying to figure out what needs to improve, how we can potentially expand the current program, and taking it step from there, and just naturally kind of evolved into where I am today.
Yeah.
And is there a person or more than one that you inspired you to do that, or is that mostly, just you?
Yeah. Oh gosh, there's so many mentors and sponsors through the years. I think if we stick to the MFM side, I would say the biggest person who has supported me since fellowship is my co-fellow, Dr. Erica Warner. She is my number one.
Wow. What a pair.
Yeah. We always reminisce about starting off fellowship, sitting in our fellow call room, looking at each other and going, how did we get here? And are we ever going to get anywhere in life? None of. And she is very much the person I call when I have a question. We bounce things off each other. We try to meet up every year at SMFM. And so she is, I would say at this point, my primary mentor inspiration. But prior to meeting Erica, throughout residency and medical school, I would say the biggest influences are Dr. Krakow, who was the prior chair of UCLA OBGYN, now the chief genomics officer for our institution. I remember rounding it with her as an intern, and her just having this massive brain of OMIM planted in her brain, and being inspired by how much knowledge she has and how she's constantly curious, how she admits when she doesn't know something, and we will sit down and look it up together. And so it was always humbling to share a space with her. Dr. Lawrence Platt, who has really sponsored me throughout my career. As a resident, I used to go to his office post-call to scan so that I could build my skill set even prior to fellowship. He's a giant in our field, always pushing the edge of technology, of how we think about fetal diagnosis. I worked with him for 6 years after moving back to California, and that was part of my tortuous path back into academics. And he has defined the privatemics sort of model where you can be in private practice and still be very much influential and academic. Dr. Joshua Coppell was sort of my primary ultrasound mentor during fellowship. So there are so many people who have really had their hands on my back as I've moved through everything, and I wouldn't be here without them.
Wow. Those are definitely some, incredible mentors to have, for sure. And if you take let's say a 30,000-foot view of your career in life, what would you share as maybe 3 pivotal moments that really perhaps shaped your career or, got you to where you are today?
Ooh. Okay, let's start with the first one that I think many in SMFM have heard about through my talk at Thrive. So in 2020, mid-pandemic, during the summer, my husband went to the emergency room with some hematuria and was diagnosed with metastatic renal cancer. This was mid-pandemic and also immediately prior to me coming on as division director here at UCLA. And my life was pretty much turned upside down. I had 2 young children at the time, 7 and 3 years old. We had to go through several months of neoadjuvant immunotherapy. Within 2 weeks of me starting as division director, he had his debulking surgery through radical nephrectomy and a partial Whipple, was in the ICU for several weeks. I remember being a brand new division director, trying to hide a lot of this from everyone else, taking calls from the ICU bedside. I would spend my day in the ICU with him, go home, put the kids to bed, come back to the ICU, and repeat that on a daily basis. And I say all of that to say that that was not the right thing to do. And I did not have the awareness and the insights and the maturity at the time to recognize that. And it really took a whole year before I realized that I was falling apart. My children to this day still talk about how they would pretend to go to bed and then hear mommy crying outside. Still makes me tear up to this day. But it was about a year after when primarily a physical health condition really led me to realize I needed help. I've always had eczema, and it got to the point where I was covered head to toe. I think I remember the dermatologist documenting 70% of my skin was excoriated. When I realized, okay, even my body is telling me that this is not reasonable. And so I went into therapy. I started medications. I processed all the trauma. I recall the PTSD of walking into the same SICU to round on our postpartum patients and our antepartum patients, knowing exactly which room my husband was in. And so did a lot of work to process the PTSD, to really learn how to set boundaries for myself, how to take care of myself. And I think in retrospect, this is what many of us, especially with the prior generation, was taught that we needed to do, is that we just put our blinders on and we just keep doing the work. And, so long as you can show up to work every day, everything will be fine. And that is absolutely not the case. And as much as maternal fetal medicine as a field is important to me, what's even more important to me is that we raise the next generation of physicians, of maternal fetal medicine specialists, of OBGYNs, to build a better, kinder, more holistic way of life for all of us. And so that's my long story of why Thrive is so important to me, why the work you're doing, Kavita, is so important to me, and why nowadays my threshold really, nothing bothers me. If everyone is alive and again, I'm surrounded by love, that's all I really need. And everything else can just slide off.
Sorry, Vince, we can't hear you. No.
I'll do something about my micro. Can you hear me now?
Yes, now we can hear you.
Okay,
Sorry.
I'll yell. Thanks for sharing that. Can you give us an update?
Oh, yes. Yeah. Oh, so happy to give an update. So we are 6 years out now, almost 6 years this summer. And he is on a schedule of scans every 3 to 4 months, and so far clear. My understanding of renal, clear cell renal cancer is initially from med school, where clear cell was a death sentence. With the advent of immunotherapy, so many things have changed. And our brilliant surgical oncologist, Dr. Brian Schiff here at UCLA, has really just been with me through this entire path. In fact, to the point where I got to deliver his second child, full circle.
Oh, wow.
Moment. And he gave me permission to talk about that. But really, every 3 to 4 months, we have a scan. And if we find something, we zap it in some way. He's had radiation therapy, he's had cryotherapy, he's had thermoablations. We just buzz it in every way possible. He calls it whack-a-mole, and it's essentially a chronic condition where we're just going to be living this way the rest of our lives. But there are absolutely moments now where he's on the slopes, back doing black diamonds and traveling the world and just living our best lives.
Wow.
So can you expand on what you said before? I wouldn't have done it that way, meaning, FMLA time, how it changes, to enjoy every moment and kind of, reshapes your life.
Yeah, that's a great point. So I do want to say that my chair at the time, Dr. Krakow, said, "What are you doing? Go home, take leave." And even with that permission, I still couldn't get myself to do it, because that being an MFM, being the best that I can be in the workspace was so much of my core being at that time that giving that up felt like I would be losing my identity. But in retrospect, I would have absolutely taken time off. I would have focused on my family. I would have, instead of trying to balance all these balls, just focused on what was most necessary at the time, knowing that everything else can wait. The division improvements that I wanted to implement could wait a few months. It's not that urgent. And I think that's something that the system really needs to have a reckoning to figure out how we can make that possible, because right now our systems are set up so that if one person goes out on leave, the load gets shared to everyone else who are already maxed out. And so it's really unfair to all of us as a whole, not just to the people who are taking on that load, that we are always on the tip of sort of a Jenga tower that's about to fall apart. And that goes for pregnancy leave, FMLA, for sick days, the number of times that all of us as MFMs probably show up with a mask on, coughing through our mask to see a patient. That really needs to stop. And in order for us to do that, we have to train enough MFMs. We have to be able to hire on more than we actually need to be able to have that buffer. And so this is something that we all together have to figure out how to do. It can't be done with just one institution or one group of people.
Wow. Thank you, first of all. Thank you for so much for sharing something so deeply personal and vulnerable. And, sorry you had that experience. But I'm so happy to hear he's doing well. It brings a smile to my face to, just thinking about that for you and your family, and I really appreciate what you just highlighted about, needing to change the culture of how we carry ourselves and as a human in medicine, not just as a doctor, because we are more than just a doctor. All the other identities, sometimes we have to prioritize those. And I think the fact that you're sharing this story is a great start to leading that change, because that's what helps people recognize the need for that change. So thank you for doing that, And as you were navigating that and even through that whole process, of course, there was definitely probably a lot of resilience that you needed to get through that. Was there anything that you would say to yourself to help get through those moments? Like, how do you get through something that is so difficult as that?
Oof. I think I would not say that the way I got through that was the right way, but it really was just putting the blinders on. It was, let's get through this meeting. Let's get through this video visit. Let's get through, this bout of dialysis. Let's get through that troponin leak, all those things. And it was one step at a time, but it was not a holistic view of what needed to be done. I think now, having gone through all of that, I did find resilience differently. It is very much, I think resilience is tied hand in hand with self-awareness. Being able to recognize when you're starting to escalate, even if you are the most stoic of individuals, recognizing that something is wrong, that you need help, that none of us are perfect and none of us can handle everything on our own. And being able to say, I'm going to offload this part. I'm going to seek help. I'm going to start myself on medications because that's what I need to do the work. And acknowledging that your weaknesses, acknowledging that need for support, I think is the ultimate sign of resilience.
So beautifully said. I love that. Thank you. Yeah.
Amazing. Chris, I want to go back to something, we started, you started talking about, the three of us are all immigrants, actually, now that I think about it.
Yeah.
And, of the 17 people we've interviewed, I think, I don't have the numbers, but I was surprised. I didn't know actually you were born in Taiwan. And many of our guests, shared that they were born somewhere else outside of the US. And you say that you were there proudly, that shapes, who you are and how you lead. In terms of taking care of minorities and the people with less means and everything else. Can you expand on that? Especially given the current times and to tell you the truth, I'm afraid that the Chris's and Judettes and whatever of the world may have more difficulty now. Coming and rotating with us and stuff. And I think anybody deserves a fair choice. I don't think anybody's better than anybody else, but certainly. Some of our backgrounds may have helped in terms of our commitment. And I wonder your personal take on all this.
Yeah, it is extremely disheartening, I think. And I do want to say that at the top of the hour, I should have said all my opinions are my own, not those of my employers or associates.
Yeah.
Yeah. But it is quite disheartening because we are absolutely a nation built on immigrants.
Mm-hmm.
And immigrants who have been displaced from their home countries, oftentimes, who come here seeking a better life and have built a better life and have built a thriving nation. And this really feels like we are going backwards right now. But as always, I remain hopeful that this is just a temporary hiccup and that we will come out of this stronger, more unified in our messaging. There will always be pockets that we can't convince, we can't encourage to come on board. But I think there are so many of us who are out there doing great things that I want to believe that the nation sees that if all immigrants are removed, we would be left with very little. And that is not at all to say that the indigenous people who were here before and who have been really sort of trampled by the waves of immigrants are not capable of excellence also, but this is just the nature of what the United States is. So I will continue to speak up. I will continue to advocate. I will continue to care for all of our immigrant populations here in Los Angeles, and to strive for inclusive excellence.
I love that.
Thank you.
Thank you. And, just going back again, and just a little bit more about you shifting to the practice of medicine as well. When you had mentioned, you used to go watch your paternal grandfather in clinic. No, I think it's a fond childhood memory. And when you think back about the way he practiced medicine, does any of it translate to how you carry yourself as a doctor or practice medicine today? Or do you think it's just completely different environments and different worlds and you can't bring it here? Or, yeah.
Yeah, it is so different because I think the older generation of physicians is very much a bygone era, especially in Taiwan or most of Asia, I would say, where physicians were sort of revered. Whatever they said went. So that has changed so much that I would say there's nothing that I can draw from that. But what I do know is that he grew up in an era in Taiwan where it had been sort of taken over, ruled by Japan. And so as a native Taiwanese trying to excel in a educational system that was not being run by your own people was difficult. And I think that I inherited that drive from him.
Wow.
Hey, I'm going to follow up on that, sorry, Kavita, real quick, because I wanted to ask you something related, Chris, meaning, I've been fascinating, Chinese medicine versus, Western medicine. And for example, moxibustion, for breech. There
Yes.
are randomized studies out there. And I know there are a couple of Chinese ones that are positive, moxibustion works. And there are a couple of non-Chinese ones, I think in Europe or US, I forgot, that it says doesn't work. And I'm like, maybe there's something that they're doing right there that we could import here. And, you're perfect in terms of background of understanding that a little bit more. As have you crossed those two worlds a little bit in your professional life, or
Yeah. So first of all, UCLA has a phenomenal integrative medicine
great.
infrastructure, and there's a whole clinic of East-West medicine that's built into the health system. In fact, I remember rotating through it as a medical student and learning how to do acupuncture. I learned how to perform massages during that rotation, which my husband gets to benefit from nowadays. But in my own personal practice, I do very much encourage complementary medicine, so long as there's no harm. And so some of the things I'm a little bit more wary about are the herbal supplements, because that could potentially have hepatic impact that could affect pharmacokinetics and coagulation. So those I'm a little bit more wary of. But things like acupuncture, moxibustion, cupping, all those things do not harm. May have benefit based on some of the studies. I truly think that some of the reasons that the studies are so different is just the inherent selection bias based on the location of where the studies are being done. If it's an immigrant population where they're a little bit, have maybe diluted out some of that trust in the traditional system, there might be differences there. Whereas in an area where this is very much the norm, perhaps there's just some placebo effect there happening. I truly believe in learning as much as I can about all the various traditional healing systems. In fact, we have a book club, and we just book club here within the residency, and we just read the book about the Hmong immigrant population, Spirit Catches You and You Fall Down, which I remember reading 24 years ago when I was just starting this journey. And now having the residents read that,
What is it called again? Sorry.
It's called The Spirit Catches You and You Fall Down.
Oh.
And it's about the Hmong community here in California and their beliefs about what makes you ill, and how that led to conflict with the medical system in the treatment of a child with seizure disorder.
Wow.
Worth reading.
Oh, thank you. No, I love that. And the fact that you have that department in UCLA, I think is very unique. Is there a certain modality or of one of those integrative medicine that you see more commonly utilized by your pregnant patient population? Or is it one that you guys refer to specifically to help with a certain condition?
Yeah, I refer a lot for acupuncture. And when my mother-in-law, who lived with us prior to her passing, was going through her chemotherapy, she had a lot of neuropathy, and being able to access acupuncture through the network here, we think helped her with some of the discomfort. I recommend that a lot for musculoskeletal ailments for our pregnant people. Moxibustion really is always only in the setting of a breech presentation will I say, if you want to go see your chiropractor, do moxibustion, eat some spicy salad, all of that is okay for me, so long as you're not doing anything crazy. So I kind of gauge it based on their openness to complementary medicine. There are some patients where I can just tell they're not going to be open to it, so there's no point in mentioning it. But the patients who I know grew up in these types of systems, I will very much incorporate that just to have a holistic view for them.
Oh, I love that. And, if I may pivot a little bit to kind of your journey into leadership, starting, from your OBGYN to MFM, like how did that journey evolve, from being an MFM fellow, graduating fellowship to where you are today? Like, how did those, things line up for you?
So I think my first entree into leadership within SMFM, let's say, was being recommended by Dr. Coppell to participate in the communications committee back then. and starting the early stages of our newsletter and being able to interact with some of the leaders within SMFM. But I think a pivotal point, actually, interestingly, was during my immediate postpartum period with my first child, who I had while I was a junior faculty at Yale. And I remember the postpartum period being so difficult and lonely, because especially since within the Chinese practice, there's the month of sitting, where essentially you're quarantined from the rest of the world. And so other than my mother/mother-in-law, they swapped off, and my husband and my child, there was very little interaction with anyone else. And so during that time was right when Facebook was starting to come into play. And I decided at that time that I was going to start a Facebook group for moms, because I was like, what is this? Like, we have this social media thing. Let's connect other moms. Maybe I can ask them for advice while I'm trying to figure out breastfeeding, what types of diapers, all those very normal things. And so I started the Facebook group for moms with an MFM, which then organically grew now to, I think all SMFM moms are invited to that group at this point. And then from there, rolled over to the broader group for all of SMFM, which then I passed off to the society to manage going forward. And I think, so first of all, I remember at that time being told by some folks, the social media thing, you should probably lay off on that and do a little bit less of it, because this is not going to help your career at all. And I decided to ignore that and say, I think building a network is going to be helpful for all of us. Mm-hmm. So that was sort of my first entree. And then from there, I would say I don't ever have aspirations to move to the next step or to constantly be seeking the next thing. My philosophy always is just to do the best in the role that I'm in at any moment to help those who are in my immediate realm. And just somehow things kept sort of falling in front of me, and I would be nudged to go into it. And so I think in terms of my tortuous path that I talked about, after I had my first child, I decided to move back to California, where my family was and where my husband's family was. And I interviewed through many academic institutions, because that was what was the right thing to do. Coming from an academic institution is that you needed to stay in academia. There's no other choice. After interviewing at multiple institutions, none of them really had the setup that I needed to thrive if I truly wanted to stay in pure academics. And so again, Dr. Platt said, hey, why don't you come join me? And, we will build a practice for you here. He gave me time each week. I would have a day, called admin, but essentially it was a day for me to spend with my child as they were growing up. Wow. I was able to work with the fellows through his office, and then from there was offered the MFM fellowship program director role, which was a little bit atypical because I wasn't even on the main campus for that fellowship. Then a few years later, the division director position came up. Once Dr. Krakow became chair, she brought me over, folded back in full-time to academics after a 7-year hiatus. And then when she stepped down, the interim chair role kind of again was nudged into it. So it wasn't like I was seeking any of these positions. It was just happened to be right place, right time. Had proven that I was able to do the work and to have the vision and the strategy. That's how I'm here today.
And it's really amazing how admired you have been, Chris. And I wonder for our, younger listeners, how you made those decisions. So clearly you described that, these opportunities came and people knocked on your door, which is great. And I think, on a personal level, I love those careers. But at the same time, sometimes people knock on your door and maybe, it's not your cup of tea. And so, when you became division director, what made you say yes? Maybe it was your boss, maybe it was the division, maybe it was something you were thinking of doing. Same thing with being chair. Did you see opportunities? Did you, what was in it? Because I think while we should do things very altruistically, where you're helping the division first and the department second, at the same time, you want to play to your strengths and do something that you like to do. And so how did you make those two decisions? How they came up?
Yeah. So for the fellowship to division director transition, that was ultimately because I felt like I had hit a ceiling in what I could do for the fellows. Because
Okay.
again, I was not on the main campus. They needed support on the main campus. There were operational issues, there were educational issues. It was somewhat of a tumultuous time for the fellowship here. And I decided that I needed to be on site with them to be able to help fix those problems, or I was doing them a disservice. And so that decision was fairly easy. Dr. Platt was very understanding of that need at the time. And so that transition kind of naturally made sense. But I think overall, same thing for the move into the chair position. It really is just about me trying to make the system I'm in better. Honestly, I could be happy if, well, actually, my husband would disagree. I was going to say I could be happy if I retired and just stayed at home. But he thinks that I would be bored out of my mind. But ultimately, it's just I want to make things better. I want to fix things. I see the problems. I'm so incredibly proud of the MFM division that we've built here and of all of our faculty and the niches that they've built. And I wanted to be able to take that and help the remainder of the department grow even more and to make us more cohesive. And so ultimately, I know it sounds cliche to say that it was about everyone else and not about me, but I think that is probably the truth, in that if I'm chair, and I will do my best job. If I'm not chair, I'll still do my best job. Just give me a job.
Beautiful. Beautiful.
Yeah, no, that's truly amazing. And I think for younger faculty listening like myself, I think one key takeaway seeing in this is really living an alignment with who you are. I think, like you said, you interviewed so many places here, but if it was not in alignment with what you wanted, you didn't say yes to those things. And then once you start doing things that align with what you want to do, the opportunities will find you. You don't have to really go seek them, and the right opportunities will find you. And I think, yeah, and I really love that you touch on academic versus private practice a little bit over there, because I think, a lot of, even as me mentoring residents and fellows now, sometimes that's a very common question people will ask, like, oh, how should I decide between private practice versus academic? But really, it's neither is better than the other. It's a symbiotic relationship. Both need both to function, and regardless, you're doing meaningful work at both places, but choosing what's right for you now. It doesn't even have to be right. It's not like a death sentence or a commitment forever. Just like you did, you moved in. You can do great work no matter where you are. So I really loved that you touched on that. And just kind of moving a little bit from that. Maybe outside of work, you touch on your family a little bit. What does Christina do outside of work, not during her work hours now? What do you do to fill your cup and find joy?
Yeah, this is where I smile the most, because that is it's where I find the most joy. So my family is my number one. I think they're listening right now because the kids have today off.
Oh, lovely.
Yes. So really coming home, getting the hugs from them, or in the case of my preteen son, a shrug. That is what brings me joy. I am so fortunate to have a very supportive husband who just kind of allows me, not that I need permission, but really lets me do what I want professionally. but also grounds me in that he's a very different personality. He's not a constantly on the go checklist type A type of person. And so having that balance is what allows me to come back from all the mania of work sometimes. The things that we love doing as a family is every Saturday we have our set list of activities. So when the kids are off at their judo class, my husband and I do our debrief walk where we talk about the week. We talk about the challenges that I'm having at work. We talk about what he has found interest in, which in the current phase is AI. So he's constantly downloading information to me about what AI platforms are available, what's coming next. And so it's a really great symbiotic relationship. After judo, I go home and I do my plant and my animal chores. That brings me peace in that I know that our turtle and our hermit crabs are alive and that my garden is thriving. And then the afternoon is the one thing that I would say brings me the most joy right now, and that's art. So when my kids have been in art class for a very long time, and at some point they kind of hit a ceiling and said, we don't want to do this anymore. This is really boring. And my husband and I looked at each other and said, well, maybe we need to model for them what learning something looks like. And I am not an artist naturally. I was telling you all that all I can draw was a uterus with a fetus in it. That was about the extent of my art. And started from scratch. And over the 2.5 years, have now moved on to oil painting. My husband is a phenomenal, born again Renaissance artist. I would say comparing his pictures to the masters, his sometimes look better. And that is 3 hours of our afternoon where I am essentially doing active meditation. My hands are busy. I can't check my phone. I think by this point, most of our trainees know that Dr. Han is occupied during those few hours unless somebody's dying. She will not pick up her phone. The ability to produce something beautiful and to hone an art that I previously did not think I had the ability to do, and to find this joy, in my perimenopausal life really gives me the insights and the reminder that I am more than just an MFM. I am more than my work self, that there are things that I will be able to do when we retire and to find joy in. So that's sort of our Saturday activity that really anchors us. But other than that, we travel, we eat, we should hike more. I've kind of fallen off the slate now that I've got this second job. We play board games, sit in front of the TV at night and watch Marvel movies with the kids. Just very normal things, I'm a mom, a wife, a person outside of my MFM persona.
Wow. Vin, sorry, we can't hear you. Yeah, I think it usually takes a few seconds.
Okay, go ahead, Kavita.
No,
then I
now we
apologize.
hear you. Now we hear
Okay,
you.
I'm not doing anything.
I
I
know.
apologize. But that's beautiful, Christina. Do you want to share more about how old your kids are and now being a mother, and I know that will bring more smiles to your face.
So my older boy is going to be 13 soon, currently in 7th grade, and the younger one, who's a girl, just turned 9 and is currently in 3rd grade.
That's wonderful. And you said your family and your kids are probably listening, so I just want to a little shout out to your kids that your mom is awesome. Yeah. And I just want to touch a little bit about coming from being so multicultural, a little bit about that, coming from an immigration family. How do you teach do you guys speak Mandarin at home still? Do you still teach it? How do you integrate those cultures? And I'd love to hear more about that. Yeah.
So my kids are fortunate enough to be in a public school, or my younger one still is, my older one was, in a public school that is Mandarin immersion. And so they do,
Ah, great.
yeah, they do 50-50 English and Chinese. And the way it works is that they swap days. So there's two classes, and one day you'll do your history class in English, one day you'll do it in Mandarin, and same thing for math and science, all those things. And that was very helpful to get them integrated into the culture and the language. I would say for my older one, who's now not in the Mandarin immersion pathway, it's fallen off a little bit. But I know that just having those foundations means that at some point in his life, he'll be able to pick it back up. We do very much have a mentality of a Chinese family. So my father-in-law lives with us. I love having the 3 generations in the house, having the children interact with their grandparents. We, I think, culturally try to have them celebrate the big moments, the Chinese New Year festivals, the Lunar New Year, the moon festivals, all those things. And so having that connection still is very important to me and to my family.
So sorry if I missed it. Is there some Mandarin speaking in the house or no?
So I do. I was better pre-pandemic. Pre-pandemic, I was exclusively Chinese speaking. I think.
Wow.
They thought I didn't speak English.
Your kids, you mean?
But man, that is a hard habit to maintain, because especially since my husband doesn't speak very much, my in-laws speak Cantonese, and so don't speak Mandarin. So at some point I got tired. I got tired of translating.
Yeah, I love Cantonese. I don't know much Mandarin, but I know a few words in Cantonese.
You do?
I love
That's
it.
great. Yeah. Wow, that's great, Chris. That's great. I didn't know. And it comes back, because I have the similar experience, and the 13-year-old, that's the year in which, they need to be themselves and whatever. The Mandarin will stay with him for a lifetime. I'm sure he'll use it, and it's a great inheritance, he got from you. That's wonderful.
Yeah. No, I love that. I love that. And then, what is one thing you look forward most to during your work day? I guess, you talked a lot about your weekend activities, but like during your work day, what is one thing you look forward to most?
Ooh, that is very hard to answer right now, because with me doing 2 jobs right now, my work day is jumping from meeting to meeting, patient to patient. It's a bit more chaotic than I would like it to be. But that is finite. Once I'm no longer interim, that should calm down. I would say you'll hear me use the word anchoring a lot, because it really does. I feel like our lives are sometimes so chaotic that you need anchor points. The 2 anchor points for me in every day is the first 15 minutes and the last 15 minutes. Every day I sit down and I look at my to-do list and shuffle things around to figure out what needs to be done that day, what can wait till later. And then as the day happens, I'm constantly adding things, and it becomes a little messy. So 15 minutes before I'm about to leave, I will reorganize it all again, so that I can check out and go home and know that that list is waiting for me tomorrow morning, and I don't need to get through that tonight. So I do get a lot of joy from playing around with my checklists, because it's my safety blanket, in that I know that everything I need to do is on there, and I don't have to carry it in my head.
But apart from the checklist, is there clinical work, administrative work, getting a project going, giving a lecture,
yes,
one-on-one with a fellow, is there something else?
Yeah. So if we're talking more sort of 10,000-foot view, I think teaching is ultimately what brings me the most joy. And that whether that's teaching a patient about the condition, or teaching our trainees about MFM or OB, is ultimately what's going to leave a lasting legacy, because none of us are going to be doing this forever. We need the next generation to take over when we retire. And that really very much brings me joy. I think that's why I came back into this role. That's why I made sure that when I was coming back to the West Coast that I had trainees around to be able to teach. I really enjoy taking complex issues and synthesizing it in a simple way for people. So I think that's ultimately still why I do this. All the other stuff is also fun. Building programs is fun. Mentoring people is fun, but I think that's the number one thing.
That's beautiful. It has been a great hour. I'll let Kavita wrap it up. A lot of people have sent kudos and best wishes, which I'm sharing. And again, thanks, Chris, for being with us. And Kavita, take it away.
Thank you so much. Yeah. No, this has been so, I feel I could keep talking to you for another hour. Just keep sharing, because a lot of the stories you share are just so deeply personal. They humanize the whole experience of everything that we all go through in medicine, that we don't hear about very often, or we don't talk about very often. But hearing them really helps us know we're not alone. And as we navigate this really demanding yet fulfilling career, we still need to know and have that sense of community. And I feel like that is something you really brought to today's conversation. So thank you so much for that. With these last few minutes, is there any, words of advice that you'd love to leave for any of our young faculty and, fellows, residents, or students that are, starting their path on into MFM or even into medicine in any way?
Yeah, I would say the most important thing is to live in the now and not be constantly thinking about the next thing. And that is true if you are in a room with a patient. Yes, there might be people waiting outside. There might be manuscripts you need to write. Be present for that patient. Be present for that student that you're trying to teach. Be present for your family when you are home. Because life really is too short. And if you're constantly thinking about the next thing, everything else is just whizzing by you and you're not making the most of it. So, my husband was laughing at me because I literally stopped to smell the flowers the other day during our walk. And he's like, you're a cliche. But stop and enjoy what you're doing. Learn the most for where you are right now. And if you excel and strive to excel in the things you do, opportunities will show up.
Yeah. Wow, no, I absolutely love that, and that is so important, and if I may just, expand on that a little bit more, because a lot of students might say, well, it's so busy. I have so much to do. How a lot of people don't know how to be present, like we haven't really taught how to be. Is there any advice you want to share on like, how can we just be here mentally? It takes a lot of practice, and yeah, but go ahead, please.
That's exactly what I was going to say. It takes a lot of practice. It takes a lot of work because I literally find myself having conversations. Yes, I do talk to myself in my head of Chris, focus, come back to this right now. And that is, I think, important also for everyone to recognize is that we are all works in progress. None of us are perfect. And we all have weaknesses, and my weakness I know is that it is difficult for me to focus in on one thing. And so find out what your weakness is, focus on that, work on that, remind yourself daily, put up signs if you need to. Somebody, I think it was my therapist, told me to put on the top of my to-do list 3 phrases: why this, why me, and why now. And that's the lens through I filter all the things that I put on there. Do I need to be the one doing it? Does it need to be done right now? And why am I doing this? So, yeah.
Wow. No, that's so beautiful. Thank you so much, Rosina. This has been truly such a soul enriching session. I feel I'm walking away with so much, and I'm sure all our listeners are as well. And I'm walking away feeling, again, like I said in my gratitude earlier, is being inspired by women, and it's women like you that continue to inspire me, that continue to help lead change in so many areas in the practice of medicine and in how we live our lives outside these roles we play as well. So thank you so much, and thank you everyone for joining. And I just want to wish everyone a beautiful weekend. Thank you.
Thank you, Grace. Thank you, Kavita. Have a wonderful weekend. Thanks again.
Thank you.
It's been great. What a session.